Latent diabetes is serious and can appear without warning. Are you familiar with diabetes or latent autoimmune diabetes in adults? It has nothing to do with eating too many sweets or sugar, like in the case of type 2 diabetes, nor is it genetic, like in the case of type 1. It shows up around the age of 35 without warning. The person starts urinating all the time, is always tired, loses weight for no apparent reason, and it can be deadly. How can you know the risk of developing this type of diabetes and which tests are recommended? I'll tell you right now, the traditional ones don't detect it. What are the symptoms and what can you do to prevent and treat this strange disease? Go ahead and leave your like and thumbs up on this video. Make sure to watch until the end. Don't become another victim. And of course, share this video in your groups and tell me, do you have type 2 diabetes? How have you been managing? Share in the comments. Friends, visit my website for all the supplements I use and recommend. You often ask me about the best omega-3 or the right dose of vitamin D with K2. Everything is on my website, my friends, in my list of supplements. My courses are there too, and soon there will be a course just about diabetes as well as my other social media. It's easy to find me. Just type Moacir Rosa into Google and you'll find my website. Latent autoimmune diabetes in adults. Diabetes means latent autoimmune diabetes in adults. It's different from type 2 diabetes, which is the most common and happens due to too many sweets and too much sugar. In the case of latent autoimmune diabetes in adults, it's autoimmune. The cells in the pancreas are attacked by our own immune system. And because of that, the patient stops producing insulin. This can lead to a condition called ketoacidosis, which is extremely serious. This type of diabetes typically develops between ages 30 and 40. So, if you're getting up 3 or 4 times at night to urinate, if you've been losing weight inexplicably and rapidly, if you always feel tired and fatigued, if you notice a sweet or ketone-like breath similar to the breath of someone who's been drinking, this could be latent diabetes. Seek medical help urgently. Ketoacidosis can be fatal, but what is ketoacidosis? Moacir, it's when the patient stops making insulin so cells can't use glucose for energy anymore. Then we start breaking down fat. That's why the patient loses weight rapidly and produces ketone bodies to use as an energy source. The problem is that this acidifies the blood and can lead to death. If you don't get treated quickly, this ketoacidosis can be fatal. The symptoms are mental confusion, dizziness, vomiting, and weakness. If you have blurred vision, if you feel these symptoms and have the signs I mentioned, seek immediate medical help. But how do you confirm the diagnosis of diabetes? LADA? Well, some tests are similar to those for regular diabetes. You will see that you have it. Blood sugar is very high after all. If you no longer produce insulin, glucose tends to stay in the bloodstream and the cell can't use it as an energy source. Glycated hemoglobin will be high. This excess glucose will be glycosylating the proteins and ketones will be elevated. This is a distinguishing factor. You're already in ketosis and you'll have a change in C-peptide. After all, your pancreas isn't able to produce insulin. Now, to confirm the diagnosis, you'll detect the presence of high glutamic acid decarboxylase antibodies, which are exactly the antibodies that attack the cells of the pancreas. Unfortunately, there's no way to prevent latent autoimmune diabetes in adults' diabetes. But you can delay the onset of these symptoms and signs and protect your pancreas as much as possible. Like with what you probably already know, avoiding foods with a lot of sugar, a lot of flour, a lot of simple carbohydrates, and avoiding inflammation. What do you mean, Moacir? Stop stuffing yourself? Processed foods, industrialized foods, foods based on hydrogenated oils, artificial substances, excess alcohol, everything that causes inflammation speeds up this autoimmune process. So, real food and regular physical exercise will help reduce your inflammation. Strategic supplements, here are some examples. Magnesium and omega-3, specifically eicosapentaenoic acid, are anti-inflammatory. Vitamin D itself, keeping vitamin D above 60 nanograms per deciliter. This helps fight all autoimmune diseases. All of this delays the onset of the disease and often delays it for years, even after the disease has set in. Then you need specific protocols. Some people don't need insulin at first, but later they need to use insulin. Then you need to follow the standard treatment for this type of diabetes. Okay, friends, stay alert, all right? These signs and symptoms appear very quickly, and you need to treat them very quickly as well. Recently, a friend of mine who graduated with me had these symptoms and ended up in the intensive care unit. It's really serious. Stay very alert, my friends. My website, don't forget to visit my website. On my website, you'll find all the supplements I use and recommend. My courses are there, my other social networks too. It's easy to find me. Just type Moacir Rosa on Google and you'll find me. I hope you enjoyed this video, my friends. I hope it was useful for you. I ask that you share it, okay? It's information that not many people know, but it's very important. A big hug to you all, an excellent hug, 2026, and until our next conversation, my friends, see you then.